Hi, so here today I wanted to talk about double standards in a large hospital workplace environment and give some serious details. And I feel as though being aware and acknowledging these double standards can help with having your voice, eventually having your voice, a stronger voice, while being aware of different double standards, talking about different understandings of double standards in a respectful manner can help navigate through these type of situations in the workplace environment. So again, I've taken some notes. I had to do my homework on it a little bit because I've gotten into situations where I ask the question, why do you think they don't even address other people when they do the same thing as, you know, say for example, I would do or someone else would do, and they look at me and say they don't expect you the same things out of you that they expect out of other people. And they just hold their head down and go, double standards, you know. And I've heard this before, and I've worked many different places. I've heard this, and I've seen it done across the board. I've even had other people ask me why the same question, you know. And I just wanted to talk about that today as it affects staff morale, patient care, overall workplace culture. And so I'm going to list some serious detailed examples of these double standards, which stems deeply from ingrained cultural norms, the things that we have been taught or taught to believe. And you know, like the higher ups and the structures of the higher ups, it comes from that. Biases related to gender and socioeconomic status, and varying expectations based on experience levels. So to know and acknowledge and be aware can help foster equal treatment across the board with a better understanding of double standards. So here we go. So today I'm talking about double standards in a large hospital work environment and some examples of serious detailed examples of these double standards. Number one would be treatment of staff based on role or hierarchy. So in many hospitals, there exists a noticeable disparity in how different roles are treated. For instance, nurses may be held to stricter attendance policies compared to physicians. A nurse who calls in sick might face disciplinary action or scrutiny, while a physician may receive leniency for similar behavior due to their higher status on that hierarchy level. Why this happens? The discrepancy often arises from traditional hierarchical structures within healthcare settings, while physicians hold more power and influence. The perception that physicians are more critical to patient outcomes can lead to unequal enforcement of policies. So what is wrong? This creates resentment among nursing staff who feel undervalued and demoralized. It can also lead to burnout, as nurses may feel pressured to work even when unwell. So some possible solutions to that would be implementing uniform attendance policies that apply equally across all roles can help mitigate this issue. Additionally, fostering an environment where all staff members feel valued and heard can improve morale. Number two, gender disparities in promotions and leadership opportunities. Women make up a significant portion of healthcare workforce, but often face barriers when it comes to promotions and leadership roles. For example, male physicians may be more likely to be considered for leadership positions over equally qualified female counterparts. Why this happens? Societal biases and stereotypes regarding gender roles contribute significantly to this issue. This is often an unconscious bias that favors men for leadership positions despite evidence showing that women excel in these roles. So what is wrong? This not only perpetuates gender inequality, but also limits the diversity of thought and experience at the leadership level, which is crucial for effective decision-making healthcare. So possible solutions for this one would be hospitals should implement transparent criteria for promotions and actively work towards mentorship programs aimed at supporting women in their career advancement. Training on unconscious bias for hiring committees can also help reduce disparities. Number 3 would be discrepancies in patient care based on insurance status. Patients with private insurance often receive faster service and better treatment options compared to those with Medicaid or no insurance at all. For instance, a patient with private insurance might have immediate access to specialists, while Medicaid patients could face long wait times or limited options. So why this happens? Financial incentives play a significant role here. Hospitals may prioritize patients who provide higher reimbursement rates over those who do not. So what is wrong with this? This practice undermines the principle of equitable care and can lead to poorer health outcomes for uninsured or uninsured patients, exacerbating health disparities within communities. So here possible solutions could be hospitals should adopt policies that ensure equitable treatment regardless of insurance status, implementing community outreach programs that focus on providing care for underserved populations can also help address these disparities. Number 4 would be workload expectations based on experience level. Newer staff members, such as residents or newly hired nurses, often face heavier workloads compared to their more experienced colleagues who may have similar responsibilities, but are given more leeway regarding workload management. So why this happens? There is often an expectation that newer employees should quote unquote prove themselves through hard work, leading to unequal distribution of tasks based on tenure rather than ability or workload capacity. What is wrong with this? This can lead to high levels of stress and burnout among new employees while allowing seasoned staff members to avoid the same pressures, creating an imbalanced work environment. Possible solutions. So some possible solutions to this would be establishing clear guidelines regarding workload distribution based on role rather than experience level can help create a fairer work environment. Regular check-ins with management about workload concerns can also empower new staff members. So conclusion to this, double standards in a large hospital workplace stems from deeply ingrained cultural norms. The hierarchy, structures, biases related to gender and socioeconomic status, and varying expectations based on experience levels. Addressing these required systemic changes within hospital policies as well as ongoing training and awareness initiatives aimed at fostering equity across all levels of staff and patient care practices. So, thank you. That's about double standards within the hospital workplace environment. Peace.